Well, I can help with that.
And at the same time, you know, we're tired of not having any input in all the decisions that are being made for us.
Well, I don't know if they're being made for you. They're benefiting somebody else.
They're being made.
You're pretty much being squeezed out, and yeah, that's about it. You're going to be put out of business. And the only doctors left are going to be the ones that are paid for by the government. And we're going to end up with socialized medicine, and our treatment's going to go down the tubes.
Well,
And
you know
it's
what's
going to be
happening
long
right
lines. People will die before they get help.
The hospitals and hospital systems are trying to make these contracts with the government, essentially, with this accountable care, they call it. And basically, they want the government to just give the hospital a lump sum of money, and then the hospital will dole out what they think that should be given to the physicians after they've taken care. And it's really it's a big threat to private practice, but it's a big threat to, you know, people being taken care of by their local physicians, by people who care for them. And we're intimately involved with our patients now. We have, I mean, I had a lady that came in today that had, her daughter's a drug addict. She's 61 years old, morbidly obese. She adopted her 3 grandchildren for reason. And she's got health problems that she can't even afford for some of the stuff. I gave her medication today that, I mean, I'm really not even supposed to, because the government would say, well, you really can't give it to this person because she's on Medicare and doesn't qualify to have this treatment or that treatment, and it's the right treatment for her.
See, I think that part of this health care law angers me the most. I really don't think anyone other than a doctor should be determining the effectiveness of treatment. I think you've gone to medical school and you're licensed to make those decisions. What treatment is recommended or prescribed, what medications. I think it's a decision between the patient and their family and their doctor as to what course of treatment they follow at whatever stage of life.
Well, you know, our patients are very nervous. You know, we have a large Medicare population. And
Well, it's already been cut by this
well,
law.
500 billion by this law, and they're nervous because they do require a lot of care. And when we talk about end-of-life issues, they're worried that is there going to be mandates put on them on their end-of-life care as they get older, or are we going to make the decision on how to treat them?
Well, I'm here to tell you I'm not allowing anybody to make an end-of-life decision for a family member of mine. I would litigate. That would be ridiculous.
Have you ever, we've all had someone that had a serious illness. I'm sure you know someone or even a family member. And you know how they were taken care of. And I think that we have the best medical care anywhere in the world, despite what some people say.
No, we do.
And we do.
We do.
And if that is going to change with this health care reform.
It has already. See, the health care bill is no longer a bill. The health care bill is a law. Now, it's a little confusing because they've played a game with the people. They passed the law, but they didn't make it effective right away. So they're going to collect tax dollars before it goes into full force and effect. And that's supposed to help fund it. But it's law now. So I was actually speaking to a father of a disabled child. She's maybe 10 years old. She has muscular dystrophy. She needs a wheelchair. She needs a respirator in order to live. That durable medical equipment is no longer covered by the policy he has now. He says, why? You've always covered it before. Nothing's changed, that it hasn't been implemented. His insurance provider said, I'm not going to have to. By the time you litigate with me, I won't have to. And so therefore, I'm not doing it now. They're looking at the laws that exist now.
So what can you do then? This is law, as you say.
It's law now.
And I don't think that we're going to get enough new Congress,
Don't dash
not
right.
enough to override a presidential veto.
Okay, here's what we're going to do.
So
We're
what
gonna
can you do?
Well, we can defund. We have the control to defund the law. If you defund it, you make it inoperable because it doesn't have the funding to operate. So that's what we're going to do. I am working on the largest margin nationwide in the House and in the Senate possible this time around. And my goal, as part of a team running on the same platform nationwide, is to get that 2/3 supermajority, just in case we're not successful in changing the president in 2012. And that 2/3 supermajority will allow us to override that presidential veto, and the people of this nation will truly run this nation as our founding fathers intended. That's a goal. Now, just by way of, shall we say, background, the reason I'm doing this is because of my children, my family. You see, I'm a busy lady. I'm already an attorney. I'm a mother and a wife. Probably I should have said that in the other order. I'm the mayor of a town, so I'm not really looking for something extra to do. I've been a former freeholder. It's not about status for me. And obviously, my husband and I, as very highly educated professionals, are able to support ourselves. So it's not about that either. The reason I'm doing this is because I am offended by the direction that Washington is going right now. It's a progressive movement focused on government control.
But we do
Now
agree.
it's being described as benevolent government control in a provider fashion. Government must provide a solution, but it's government control nonetheless. And the difficulty I have with that is it is completely un-American, because this nation was founded on liberty and freedom, independence, being self-sufficient. The American dream, frankly, is that family-owned business, entrepreneur opening a business, family working it with them, passing that on, as well as any assets, real estate or other assets that you acquire from a successful operation of business, passing it on to your kids. That's the American dream. And with this government control, this progressive movement in Washington, we're annihilating that.
But we do, I think we all agree that we do need some health care reform.
Absolutely.
And I'm not even sure we should call it health care reform. I think we need health insurance reform.
Yeah, and we need tort reform as well. I would start.
Well, let's finish with the
Okay.
health. What do you feel? I mean, I think the government's passed their boundaries by passing this unfunded mandate, as I would say, this whole health care reform.
Mm-hmm.
But what can we do as far as health insurance reform, where we as physicians, obviously have many problems with insurance companies, and you can't buy insurance across states, and the premiums just keep going up.
Right.
But what can we do about having health insurance reform and leaving maybe some parts of it, good parts of health care reform in?
Well, I think that H.R. 3400 is some of those good parts, and I've been looking at it. It was actually introduced by Congressman Price from Georgia. So I want you to take a look at that one, H.R. 3400, and tell me what you think.
At least you read it, huh?
Yes, I read it. I read the summary. I read the bill itself, and it looks to me, and there's some funding references at the end of it that seem to relate back to other things, and I don't like when we do that, but I understand why they do that, because there has to be funding for the law, or we're not going to approve it. But I'd rather it be direct funding with a budget change rather than relating back and forth to the law. But everything that relates to health insurance and health care reform, as we call it, I think is good. It may not be everything that we need. It does have a tort reform element. As far as insurance reform, as you're calling it, I think what we have to do is look at a free market type principle and allow that to occur. You don't create a free market. You get out of the way in order to allow a free market to exist. But frankly, I use auto insurance as an example. When I was a kid, nobody advertised for auto insurance. Now, you've got commercials on the television for one auto insurance provider or another. Prudential, Allstate, State Farm, okay? That's what I want to see happen with health care insurance. When I see those commercials on the television, coupled with the ability to compete across state lines. If I want to buy an insurance policy from a company in California and I live in New Jersey, I should be able to do that. Because it's the protectionism that eliminates competition and drives costs up. When the costs are up, people are paying more than they should. The corporation is benefiting, but the people themselves are not. And as your costs go up, then your quality of life goes down. And in the area of healthcare with insurance, if the cost is astronomical and the government is mandating the type of policy, which is what the law does now, there's nowhere for you to go. And we're doing this at the cost of $1 trillion to administer it, heaped on top of 2 bailouts, and I call them both bailouts, okay, and then a stimulus, And you've got a load of people that are out of work. I mean, New Jersey has lost almost 86,000 jobs since January 2009. We're at it almost stagnant. I mean, it fluctuates and then lands where it is again. Unemployment rate of over 9%. We go up, we go down, we kind of stay, we hover at about 9.5%.
9.6, right?
Yeah, okay? That stagnant unemployment rate is worse than you think. Stagnant, the word itself, makes you think of, nothing moving. But because the unemployment rate is stagnant, it means that people are moving through, falling off, and more people are coming in. It's a terrible situation. So whatever this administration in Washington thinks they're doing to stimulate the economy, it's not working. And so I think in healthcare what we can do is create that free market environment. I also think we need to look at public option healthcare. We can't eliminate it altogether. But I do think if we were to provide a voucher to the patient, instead of dictating which doctors they go to, then that patient would have the opportunity to go to a doctor of their choosing. The voucher would be used to make payment to a certain point. It would be up to the doctor whether they accept that as full payment or whether they require an additional copay or additional balance due, which could then be paid according to an agreement between the doctor and the patient.
I go further. I think that would be a good system even for the Medicare patient.
Absolutely. That's the public option.
Why, the government should pay a certain amount. And this way we know what the government pays. And if the patient wants to come to see you and there's an additional amount, well, then that's the patient's responsibility. As opposed to right now, we're forced into accepting whatever the government is going to pay. And
That's
Joe and
right.
I run a small business. I know you'll get in a second, but Joe and I, and over the last 10 to 15 years, we've only seen our reimbursements go down and all our costs go up. Mm-hmm. We've run our malpractice costs, health insurance costs. All my workers, I love them all, and they all want raises. Doctors are going out of business. And this is happening much more frequently than people think. So we have all these regulations. We have all these unfunded mandates we have to deal with. We work at all hours. As you say, Joe and I just came from the hospital in the office, come to talk to you, and we're going back to the hospital. We're done. So we all work. But just to get off this issue, let's talk about primary care in New Jersey for a second.
Okay.
Okay? And then we'll go into the malpractice issue.
Mm-hmm.
Right now, in New Jersey, we have quite a deficit of primary care physicians. Mm-hmm. And since we have about 400,000 illegal residents in New Jersey, then, and the number of doctors that we graduate in New Jersey, probably 10 to 15% are staying in state, obviously because of taxes and everything else.
Right.
We have to figure out a solution to this because we don't have primary care doctors that are going to be able to take care of these people.
The reason you don't have those primary care doctors is because the environment is so oppressive to you making any kind of money doing this work. And so the younger population that's coming out through college is not seeking employment in that area. And the reason they're not doing that is because they know they're not going to make money. They see the trend squeezing you out of business. I mean, if you're sending your kid to college and you're going to pay $40,000 a year tuition, okay, or semester maybe, you're not going to encourage them to go into an industry where they're not going to make any money.
And plus have $200,000 in debt when they come out of school.
Of course.
And so what is the solution? How are we going to get these physicians to stay?
Well, I think the first thing we have to do, you mentioned the illegal residents in New Jersey. Now, I know that we were talking about health care here, but there is a health care element that is impacted by immigration enforcement, and that's the charity care element at the hospitals. I happen to be an expert in immigration law. I've been doing this for almost 20 years. Yes, I'm old enough to do it for over 20 years. I have an 18-year-old daughter. I'm definitely come to grips with my age. But at any rate, charity care is bad for two reasons. It's bad for the hospital because of the Hippocratic Oath and the need to treat people if they're ill, and the liability issues if they turn them away. Okay, because even if a person is illegally present in the United States, they are able to sue through the state court system, and so it's problematic in that way. The lines are incredibly long. It's problematic for the patient on that. The taxpayers are being abused in that they have to subsidize the hospital for this care that they offer at a great expense but receive no payment for. And I'm going to tell you that these undocumented persons do have the ability to pay something toward their medical care, but because they have no documents, and they are not legally present, they are not able to demonstrate any income, and therefore de facto become eligible for programs like charity care.